So that would be a positive because it's not a controlled movement. And thinking about what are, so remembering up to the first 15 degrees, you have your supraspinatus. After the 15 degrees, what muscle takes over? The deltoid, exactly. So the deltoid takes over. So most of the time you'll have the patient actually be able to come down, and they just can't control it because something's wrong with their supraspinatus. The other one is that empty hand test. So what you're doing is actually abducting again and bringing it internally rotating it and resisting now. So your abs is doing exactly to push up and you push down. All right, that's that empty hand. And so then your infraspinatus and teres minor. So what you're doing, so how do you make sure that you're isolating the external rotators of the shoulder? So you're having the patient have their arms adducted, right at their elbows. So then you tell them to push out to do that external rotation, resist them. Okay, that's going to be a positive. So a positive test would be what? Pain. And like
inability.
Exactly, some weakness or something that's preventing them from being able to do that resisted external rotation. All right. So the next one is going to be the subscapularis. So lift off, if they don't have anything that's preventing them from doing the internal rotation, is making sure that they actually push, but, so this is the correct form. It's a complete total push-up of it, okay? Somebody who has a positive test and they're trying to actually, trying to do it, but they can't, they're gonna be pushing off their hands, but not the actual arm itself, okay, or the shoulder itself. If they say, oh, I can't internally rotate. So then you're gonna do doing this modification. We call it Napoleon, but basically we recall that it's the doing the internal rotation. So they're gonna actually be pushing towards their stomach, and you're gonna be resisting. So trying to push them back out. Positive would be that they can't resist you, and then pain. And the reason why with this one versus here, kind of the action is to push it out versus here is to push it in. It's because of how that changes with that plane or that internal rotation. Exactly.